Share my computer. All right, so officially welcome to our partners and colleagues from Kent County Health Department to Public Health 500, to this introduction opportunity for us to learn a little bit more about the work that you're doing at the health department and also how it connects with our partnership between the health department and the university and Grand Valley Public Health specifically. So open conversation to do some introductions, who you are, what you do, how you got there, tell some stories, whatever you feel comfortable with, and we'll also open it up for those who are in the room to ask some questions after we've done introductions and try to, make the conversation more lively at the end. Okay, so I don't care how you all start, but the floor is yours.
I'll kick things off since I'm later a little bit. So hi, my name is Janine O'Donnell. I'm a public health program supervisor at the health department. So a little bit about my background. I graduated with my MPH in 2016, which is a lot further away than it seems. And I focus on global health. So we had the option, we had I think 5 or 6 track options. But I would say global health was kind of a mixture of health promotion and epi, probably leaning more towards epi side. So I focus mostly on infectious disease. I did my, practicum experience in the summer in South Africa. So I was looking at the HIV treatment cascade there. I was there for 4 months. And then after I graduated, I worked for the Michigan Public Health Institute. So they're located in Okemos, I believe. But they're a contract, they do a lot of contract work with MDHHS. So I was a research assistant. I was actually in that role working on a study that was done through U of M. So I was doing a lot of interviewing and different kinds of testing with children. So I was there for I think 7 months. I moved back to Rhode Island where I had done my grad program. I was there for 1.5 years working on a substance use grant. And then I came back to Michigan. So I was moving a lot during that time, and I worked for the state of Michigan for about 7 months, I think, again on a substance use grant, and then I landed at the Kent County Health Department. I've been here for 5 years next month, and here I work in a Center for Community Health Strategy along with Maris and Hannah, and I do a lot of community engagement work, health equity work. I oversee our academic health department, so all of our interns, we take on interns 3 times a year, so spring, summer, and then the winter semester. I can go into more about what I do, but I can pass the mic for now. Oh.
Hi, I'm Mindy Hunsinger, the emergency preparedness specialist at the health department, and I've been in my role for about 13 months. And I am an attestation that practicums do work. So you guys haven't had your practicum yet, but I had my practicum at the health department in the fall of 2020. It was my preceptor was at the time, she was the emergency preparedness coordinator. She is still with the health department, but she's since promoted. So really, emergency preparedness isn't really anything that I ever saw myself going into. It was really that practicum that made me fall in love with EP, that made me realize, oh, I can do this. I can be very, very good at this. And so that's really just how I landed at the health department. So
To the GVSU grad?
Oh, I graduated from this program. I was cohort 8, so the spring of 21. Got it. On the way in, we were talking. I was like, my years are so jumbled because of COVID. I think I graduated in 21, so cohort 8 is what I remember.
And just a quick disclaimer, there are 4 divisions in the health department: administration. So technically I am housed in administration in the Center for Community Health Strategy. Mindy is in administration. We also have community wellness coming up here. Got the clinics division and then environmental health represented on the end. So we'll talk more about that, but just to give you guys an idea a little bit of our infrastructure.
Hi everyone, my name is Carolyn Quiney, and I am a health educator within community wellness, primarily in health education and promotion. I've actually been at the health department almost 30 years, so yeah, lots of experience, a whole variety of things that I've done over the years. My training, what I originally planned to work on, tied to human sexuality and prevention of sexually transmitted infections, things along those lines. But now I focus in healthy eating, active living, tobacco prevention. So definitely a very different focus. So that's one of the things I like to say is have a focus within your public health training, but sometimes you land in something that's totally different than what you had originally planned on. And that's one of the things that's so exciting about public health is that you get a lot of variety in what you do, and that's what I've had quite a bit of over the years. I also interned at the health department, before I started there, so, yeah.
Hi, everyone. My name is Maris Bremmel, and I'm an epidemiologist with the health department. Like Janie said, I'm in the Center for Community Health Strategy Administration area. But my biggest project at the health department is doing the community health needs assessment. We do it every 3 years, and this year, we also call it CHNA, it's the acronym for it. But this year is a CHNA year, so lots of data collection, data analysis, report writing, all that good stuff. Before, I've been at the health department for about 4.5 years. Before that, I worked for the Johnson Center, which is in Grand Valley, for about 2 years, doing kind of applied research projects for some local nonprofits and foundations. I'm also a Grand Valley graduate. I graduated in 2017, I believe. I don't know what moment that is. But yeah, and I epidemiology. My undergrad was in social science, so I'm kind of right in the area that I went to school for. I can't say I necessarily like planned out to get into this position, but I'm glad that that's where I ended up. So.
And my name is Hannah Napolello. I'm a health educator at the County Health Department. I'm housed in the Environmental Health Division. I graduated from GVSU's Public Health Program in 2018, so I got like some diversity when I got here. And I did the epidemiology emphasis, but ended up in health education. So when I was in grad school, I spent a lot of time and got connected to a community-based organization, the Grand Rapids Red Project, if you've heard of that at this point. And learned that I loved like that community-based engagement type work. So my first job out of grad school was a health education position for community mental health, doing substance use prevention type work. That was in Berry County, and I live in Grand Rapids, so it's great to commute every day. So I really wanted to be able to live and work in Grand Rapids in Kent County. So was fortunate enough to end up at Kent County Health Department and doing environmental health, which is something I didn't see myself doing at all. Had never spent much time in that field, but now I specifically do lead poisoning prevention work. So we have a lead team within environmental health, and we do a lot of different things, but my job is mostly around that community education and making sure that we have stakeholders and community partners and community representation engaged in the issue of lead, who have, have some vested interest in it, to be working together to address those issues around that.
So before we launch into questions, and as we got this file, we had a really cool experience today. I wonder if you could talk about it.
So I guess I should probably explain a little bit of what emergency preparedness is. So if I had to explain emergency preparedness to everybody, it's going to fall into kind of 4 buckets. So it's planning, training, exercise, and response. So there's nothing that I do, probably very little that I do, that doesn't fall into one of those 4 buckets on a daily, weekly, monthly, yearly basis. So today I was actually at a training over in Muskegon where it was with residents, and it was the first time that it was an active shooter response. So I was a victim. I wasn't actually participating in like I'm triaging patients. I was just a victim. But they moulaged me. I tried to wipe it all off, which means that they actually gave me like a gunshot wound. They gave me a little piece of paper saying, oh, you're a victim. This is where you've been shot. This is how old you are. This is your knowledge. And then they told us it was at Baker College. So they said, here are the rooms that you can hide in, go hide. And so then they basically had to clear the rooms. They had to come in and find us. And then these residents had to triage us based on our injuries. And so it's a really cool experience. And so I was like running late. I wasn't sure if I was going to make it back in time or not, but here I am. So it was really just, it's one of the partnerships that we do. We're constantly training. We can't do what we do without community partnerships, probably any of us, to be honest. And so it's really just what it's all about at the health department.
And emergency preparedness is involved, like, anytime there's, so like, I imagine maybe you've done some of the tornado response stuff, but like, anytime there's like a natural disaster, like a big event in Kent County. So like the ice storms, anytime we kind of need to coordinate around getting different resources to people. Obviously during COVID, it was trying to coordinate, vaccine clinics, figuring out how to triage who gets the vaccine. So, in the beginning of the pandemic, when the vaccine was released, there were instructions from the state, but they weren't incredibly clear in a lot of ways. And so it was really on the health department to figure out how to interpret what we were seeing. It was a scarce medical resource that a lot of people needed. So there's a lot of really difficult decisions. We actually employed an ethicist during that time to help us navigate all of that, but that was really driven by the emergency preparedness group. And I would say that's definitely the biggest response you guys
Yeah.
had to undertake.
So that was actually when I did my practicum went down. So I went in and yeah, it was definitely, but that's why I fell in love with it. It's like, I'm making a difference. So when I got there, the health department had just found out that they were getting the vaccine, so they didn't know how much they were getting. So if you think about it in terms of, are they getting a few? Who gets those? First responders? Is it health department frontline workers so that the health department doesn't shut down? But then if you flip that over, what if they get a lot? How do you get those vaccines to the entire community very quickly? So they didn't know what kind they were getting, so they didn't know if it'd be frozen, refrigerated. They don't know how they were gonna store it. They didn't know when they were
You
gonna
could
get
use
it.
it within a couple hours, so there were six
Yeah.
doses per vial, so you also like had to be very diligent about having like backup, so if people didn't show up for
Yes.
appointments, how do you make sure you don't waste
Yes.
something that was that important?
Yes. And so they had no information and then they were like, all right, let's plan. So that's what emergency preparedness was doing. So a lot of my practicum was actually researching and creating contingency plans for EP so that whenever they got more information, they could just roll with it. So that was interesting.
Assuming nobody else here was a active shooter victim today, I'll ask the question, what is like, I always think of it as like pits and peaks or roses and thorns, but what's like a really good thing about your job and what's something that you don't like as well? Harris, you like, you have something you want to talk about?
I think what I personally like best about my job is that it kind of dabbles in each area of public health. So with the community health needs assessment specifically, it covers everything from like chronic disease prevalence in the community to like smoking rates, oh my gosh, there's so much I can't even like think of things. Like mental and physical health, self-reported mental and physical health, maternal and child health. All of the kind of social determinants, so access to care, housing, income, transportation, all of that stuff. So it's a really like full picture view of public health in an area. And I really like, sometimes it's hard because I'm obviously not an expert in every single one of those areas. But it kind of brushes the surface of all of those areas and kind of pulling everything together in terms of data, and really getting that full picture. So I really enjoy that piece of it. I think the most challenging part is, things take a while in government, specifically, I think. And so sometimes you're waiting on things and you have a timeline in mind and things don't go according to that timeline at all because you're waiting on things from other people or to get approval or to get reviewed. So things can move kind of slowly. But
I can go, I guess, from my perspective, the thing that I enjoy the most about the work that I do is the relationships that you develop within the community. A lot of the work I do is within different neighborhoods, different target areas within this, primarily within the city of Grand Rapids, but also with organizations that work within those neighborhoods. So you're working very closely with residents, you're working very closely with those community-based organizations, nonprofits that are right in there in the community. And those relationships that you develop with folks are just very rewarding. And to be able to see some of the progress that occurs at that level is fantastic. I kind of, similar to Mara's, the frustration is sometimes that government component of things and how government works with certain hoops that need to be jumped through and things along those lines. I also think a lot of the politics that are kind of playing in health and public health are frustrating as well right now.
And Carolyn, just in case anyone here is interested in healthy eating, active living, or obesity work, can you name some of the partners that you work with?
Oh.
In the Grand Rapids area? Just if there's,
We work
I know there's
with,
probably a lot.
we actually work with a lot of the neighborhood associations, within the city, some much, more closely than others. Roosevelt Park Neighborhood Association is one that we have a fantastic relationship with. The West Michigan Hispanic Chamber of Commerce is another group that we work with quite regularly. Access of West Michigan, which is much more food policy based. City of Grand Rapids with their recreation department in relation to parks and utilization of park services, transportation and safety issues. A lot of what we're doing right now ties to built environment and ensuring that built environment is accessible for individuals to be active, to be able to get to their parks, to be able to get to the schools safely, things along those lines. So it's to go through the list, there's just a ton. There's a ton, so.
I would say I kind of resonate with everything that's really been said. Partnerships are like the only way that we get any of the work that we do done. So many of the issues that we work on are so multifaceted and so big that we could never do it as just a health department. We need those community partners. And those are really cool things to see, those relationships to see grow and develop. So we have a lead action team that's a county coalition that is kind of still pretty relatively new. And so trying to build relationships with community partners and even just parents and grandparents who might have some sort of vested interest and are concerned about lead and lead in children, getting them to the table and being able to provide them opportunities to share their voice with us and as a group is really, I feel like, public health in action. But yeah, I would say the challenging part is that the last few years has kind of really changed the flexibility that we have in the work that we do. Yeah, just kind of changed the way that people view public health work and the policies that might come out of that too, locally, state, and federally. So I think that kind of puts some constraints on us that can be more challenging.
Sure. I really don't have anything new to add because I agree with everything they said. So it's not just external partnerships, but it's also like those internal partnerships. So the people that I work with at Kent County are absolutely amazing, like every single one of them, because everybody's passionate about what they do. They want to be there and everybody's working towards the same goal, just from different perspectives. And it's probably the healthiest work environment that I've ever been in my entire life. So, so it's internal and it's external partnerships. And then I don't know, I love my job so much that there's not really much that I don't love. I'm sorry.
I would say for me, and this echoes what a lot of people have said, but I think I just really appreciate working in public service a lot, and having the opportunity to feel like I'm making a difference. I've got friends who are not super fulfilled by what they do. They're not able to engage in community, which is something I really appreciate. And so I just feel really lucky. And Carolyn, you kind of touched on this, but it's also really cool that you aren't really pigeonholed into one specific topic. So when I was first hired, and this is still part of my role, but I do public health accreditation, which basically I have to have a pretty good understanding of the entire health department. We get accredited nationally, so you have to be accredited by the state. That's just a requirement. You have to jump through hoops to do it, but every single health department must, that's required. National accreditation is optional. It's a little bit more strenuous, I would say, and we opted to do that. So when I came on, we had done it 5 years previously. We were going through the process of redoing it. So it was very like project managing, I would say. I didn't really need to be a content matter expert. I just needed to understand how to work with people, ask people multiple times for the same thing and like not get frustrated and that hopefully not have them be frustrated at me. But it was very like technical, and now most of what I do, so we'll do that again in 4 years. And I'll be in charge of that, but most of what I do now is like community engagement. Like I said, I work on the CHNA. It's just a lot more kind of community outreach, I'd say. And then what I don't like, which people mention this, but it can be really political. In many ways, I feel like weird saying that because we're not in Ottawa. If you don't know about that, you should read about it. But it still is political, and so there are times you feel really powerless, and decisions are being made by folks that aren't content matter experts, and so that can be tough. So before I keep asking questions, I can turn it out to you all.
Hearing to you all, it sounds like you guys have a lot of community engagement. But if people are not used to dealing with community, do you guys have advice for asking progress or what to look for in terms of how to get involved with them, like how to get the community piece into, I don't know, talk to kids or talking to classmates, but how do you actively search out community partners?
Yeah, I think for me at least, one of the biggest lessons I learned is that it's not enough to collect data from communities. So I think a lot of people feel like I've engaged community because I did a survey with them or I did a focus group with them, and that's part of it. But I think the bigger piece is how are you going to use that information to benefit them? So like even with the community health needs assessment, in the past, I would say there were areas we could improve upon in terms of like, we could say closing the loop, but like getting information back to community. So we're trying to be super intentional about that this cycle, to make sure people understand, like, we're coming to you, we're asking for responses specifically from your community for these reasons, because you're underrepresented in data. So when you or others that maybe serve your population go to write grants, there's not local level data. That's really important. So like trying to emphasize to them, like, here's the benefit to you, because they're often understaffed, underfunded, limited capacity. So when you come and you feel like, I'm doing you a favor, they feel like you're a burden. And so you have to like find a way to make sure that you're listening to them and understanding what their needs are. And that's the other piece, not coming in and being like, I know what you need and here's what it is, because my class told me I had to do this project, or my grant is telling me I have to do it this way, because that might not be what they want. And so just being willing to actually listen, I would say.
And I think a lot of it too is like having that relationship building with folks. So, being there multiple times.
Yeah.
Not just going in, doing what you needed to do and then leaving. It's maintaining that relationship. So, if you have funding to work in a certain area, continuing to work in that area once that funding is gone. And that can be a challenge because sometimes the funding is pulling you elsewhere. And we have to advocate even within our own organization to stay and to maintain that relationship, because these folks need that connection and they need to be able to feel like they can trust us for that back and forth, so that they do feel like they're gaining something from us, not just the other way around. So
I think also it's, treating that partner as the expert of their community, because they are, that's a huge piece of it. And for me anyways, I think like forming those partnerships, like how do you even start, I think it could be something as simple as like a 15-30 minute Zoom meeting with just one-on-one with someone, just to get to know them, but also understand the work that they do, that their organization does, and kind of try and find any opportunities for alignment, and just kind of start building a partnership through that relationship piece, is a big part of it. And then of course the sustainability, giving back to that partner, so you're not just taking, it's not a partnership with a one-way benefit. You're both getting something out of it. I think that goes a long way.
I would say like all these things are so true, but they're hard. Like these are really hard things to do. In the constraints that you might have.
even just in funding, like, we have some really cool grants right now at the health department that allow us to pay for people's time to be on groups and in coalitions and, apply for mini grants to be able to, like, Jamie and Maris are doing a lot of things like that. But those are kind of unique things, and I think that those are gonna maybe hopefully become more common, that, you know, the grant structures allow for you to spend money like that, because public grants can sometimes really restrict you on how you spend your money and what way you give it to. So I think one of the evolutions of being able to see more of this work is going to come from things like that.
And it takes a lot of time, a lot of.
I'd say too, sorry, the great thing about working at the health department is there's a lot of institutional knowledge there. There are a lot of people who've been there for a very long time, so.
I would be someone who's been there 38 years. Margaret's got eight.
Right, my coordinator has been there for 26 or 27 years, and so she's already formed a lot of partnerships and relationships, and so what I need to do is come in and I won't say piggyback off of her, but you know, she's paved the way for me. And I just have to maintain them, not just because it is a lot of hard work, it's like monthly, it's weekly.
But if you came in like a wrecking ball, they wouldn't want to know you.
Oh,
You have to be
absolutely not.
cognizant of
And
like,
so-
oh, this is partner, what are they like?
Yeah, exactly. I think something to remember is that you're not in it alone, especially if you work in Kent County. I can't speak about other health departments, but you're not in it alone.
I was just gonna say one last thing in reference to what Hannah said about grant funding. I had an experience that was really exciting. We actually had a funder come to us and say, we really like what you're doing with community, that you're like compensating community, treating them like experts. We want to give you money. And it's the first time in my life. Granted, I haven't been in this career my whole life, but it was really fascinating to be like, oh, cool. They were just like, here's the money, you can have it, instead of us being writing a grant and going through the whole process. So that was really exciting. And the cool thing too, was we were able to actually say, we don't want to take that money, but let's have it go through our partner. So they were able to get some like overhead dollars and things, and they're managing that portion of the grant. So it was really exciting. So I think the grantors are kind of starting to take on that stuff.
Are you able to describe maybe just a recent or something that comes to mind, like a day-to-day of what your job looks like when you go in?
I don't know about you guys, it varies.
So when I started in my practicum, I was told there are no 2 days in EP that was exactly the same. And I was like, okay, I understand what those words mean. What does that mean for the job? Like, that doesn't help me understand what the job looks like. It's true.
I think when you get derailed, like.
I don't know what the job looks like.
No, and so no response is the same.
And you don't know when you're gonna need to respond, like we've had food poisoning things that just come up, like, so you come in that day and you're like, okay, this is what I'm doing today.
Multi-state, I stuck out very cool. Or, you know, there's a lot of situational awareness with what I do. So it's like the monkeypox, it's the STEC. That was before my time. Recently, the health department has been partnering with MDHHS for getting ahead of lead. So it's a pilot program that they really want to spread throughout the rest of the state. And so they've come to Kent County to partner to kind of work out the kinks while they do that. So emergency preparedness, environmental health, a bunch of different programs in the health department have been working on that. And so we have had a ton of distribution events and distribution sites, and even 2 different distribution days at the same site look completely different. It completely depends on the day. It depends on the people who are working. It depends on the weather. It depends on the people who are coming out to the building or wherever it is. Like, I wish I could give you a very solid answer, but it just looks so different every single day, at least for EB.
And I think that's probably holds true for a lot of things. Now, you may have one day, okay, I'm in the office today, and you can focus all day on some things in the office, or you may have a day where you're going from one meeting to the next, and every meeting is something different. So if I think of, you know, one of my days that is consistently hitting on multiple things, on a Tuesday is the day that I have a lot of coalition stuff. So my first meeting is a coalition focusing on tobacco. So we're talking about prevention, we're talking about advocacy efforts, we're talking about the legislative action that's coming down or soon to come down in the state, watch for it. On preventing tobacco use and protecting the communities. So that's the first group. So that's, an hour and a half meeting there. Then I'm moving on to healthy eating, active living, where we've got another coalition meeting and we're talking about park work and, what are we doing within the parks? What are some things that need to be done? What are some activities that are available? Learning about, hey, there's a school program in Grand Rapids provides gear for community folks to do all kinds of different park related efforts. People didn't even know that existed. It's relatively new, but it's a great thing. And then I'm on to a coalition group that's meeting to address truck traffic safety in a neighborhood and their concerns about pollution. And how all the trucks go down this neighborhood street and within this Black and brown community, and why the city is not willing to ticket, what the involvement is with the Michigan Department of Transportation. I mean, you're pulling in all these different things that you never really thought about in relation to public health, Anyone ever told me I'd be working with traffic engineers, I would have been like, really? So, I mean, you just get a whole variety of things that then fit in there, and then you may be on to a whole nother topic, and a whole nother meeting, so.
I think, for myself, I'm funded under 3 grants and then also general fund, which is like basically money from the health department. So a lot of times I'm doing like grant specific work, just to kind of echo what your kind of format of talking about like today. I was answering emails this morning, doing some community health needs assessment work, and then writing a blog about community engagement and compensating community for their expertise for the University of Michigan. Then I had a meeting that was supposed to be an hour and a half and was 2 hours or 2.5 hours around the Health Equity Council. So that was planning. We've got some community facing, some external meetings coming up next week. And then in a couple weeks after that, so just like planning for what that's going to look like, talking about some internal infrastructure stuff within that council. Trying to think what else we talked about today, mostly that some community, we talked about the CHNA a little bit in that meeting, and then immediately after that, I was actually almost late to my next meeting with the health system to talk about data sharing, so trying to get access to some of their social determinant of health data, and just talking through like what data points I would like to have access to ideally. They might give us the, by the way, the demographic data we were asking for, so that's nice for the CHNA. And then I came here, so did this panel, and then I'll go home and work on my blog some more. So I would say I typically have between 2 to 5 meetings a day. Like there's some meetings or some days that it's back to back meetings, which I get really crowded. Especially in like the virtual world where it's truly like there is no break. So that can get to be kind of a lot. And there's some days that I just don't want to talk anymore.
For me, it's a lot, I guess, not thinking about the specific days, but like kind of zooming out, there's a lot of, and everybody gave examples of this, but communication, a lot of answering emails, and like keeping emails straight and organized, a lot of planning for future events. A lot of work goes into that. I think I was surprised by how much effort it takes to plan a meeting with 20 community partners. So that's a lot of it. For stuff related to EPI, it's anything from designing surveys to coming up with focus group questions and writing consent forms for focus group participants. Figuring out how you're going to administer a survey. Are you going to make it available electronically, paper, through mail? So kind of planning out some of those logistics to like plan for data collection. And then maybe programming it into an online survey platform and figuring out how can we get this out to the community so that people are participating in the survey. And then data analysis, so that's cleaning the data sets, doing the analysis, looking at secondary sources of data, so what data is already out there that we can use that's related to this. And for CHNA specifically, like report writing is a big part of it, and I think Jane mentioned this, but like also getting data back to communities, so not only presenting data back out to people, but making sure that they have the data sets, or they have a data brief of data that's relevant for their community. And that's another, I guess with my job, I get a lot of requests for data from people, so sometimes it'll be random people that I've never met who are emailing me asking, you know, do you have data on like food stamp enrollment for Kent County? That was one I got recently. Or do you have data for the 49507 zip code related to like housing or something? So a lot of specific data requests from people. So yeah, just pulling data kind of, and then also disseminating it back out. A couple of pieces of my job that I didn't really expect with focusing so much on data and epidemiology is project management. So that's been a big piece of it that's like kind of every day. And it goes along with like the communication and planning, but just managing all the different moving pieces. And making sure whoever on your team is also like up to date and knows where everyone's at. And then also presenting, like actually standing up and presenting in front of like maybe 100 people or something. I always really hated presenting. It's now gotten to a point where it's like, I don't love it, but I'm fine with it. So
She used to
lot of
fight me
practice.
every time we would have to present. She'd like just look at me for a long time, like, are you gonna have this?
but yeah, that's also like part of the job.
Can you give us some examples about how there's been a lot of talk about sharing back to the community? So you said you get data requests, which is, this data is publicly available, right? So when she gets this email that says, I want the zip code information,
Yeah.
you can do that.
Yeah, so a lot of the data requests, like we have so much data that we collect for the CHNA, so we do a number of surveys, focus groups. There's a lot of data that's collected for it. Not all of it makes it into the CHNA report that gets sent out to the public. So we have people asking for data that is oftentimes available through existing sources, like it's already out there. They could find it themselves. And I could easily like send them a link to the American Community Survey, that's the Census Bureau's data source has like everything. I could easily just like send them that link and be like, it's on there, good luck. But again, I think Jeannie mentioned this, a lot of organizations are understaffed, underfunded. They might not like speak data. So if they are looking at something that's all percentages and numbers, and there's all this like technical, this language, that's a lot of times really confusing and like overwhelming. So when I get those data requests, I pull all the data and kind of pull it into a format that's easily, that can be understood by like anyone. You don't have to know what margins of error are, or you don't have to know what confidence intervals are to interpret this data. So, and I think also with sharing back, that's like, I guess our team at the health department is so focused on health equity, and it's very much been like a learning experience for all of us. I feel like we're learning new things as we go in terms of how to just like do a better job with that. And part of that is data. So these community partners, community members are taking the time to participate in focus groups, to fill out surveys, to give us this data that we need for the needs assessment. So I think it's our responsibility, like technically it's not our data, it's the community's data, so they should have that. So that's part of it too. It's like taking the data that we got from them and then giving it back to them so that they can make their own planning decisions with the data that came from their community.
And I would say sometimes that information is shared through those community-based organizations. So they're then sharing that information within their community, within those community connections. So that folks are able to actually hear it back rather than Maris giving it directly to them, because they don't know who's Maris, and do they really get what that connection to the health department? So working, through that, well-trusted community individual is the best way to get that information back to folks. And sometimes it's through their events, and, you create a nice, display and a nice poster detailing all the information that was gathered within that group, within that community. And they're coming and visiting your space at the event and hearing a little bit from you, connecting with you. And that could be through a neighborhood-based event, a school-based event. It's multiple ways, I think, is really how we have to do it to make sure you're getting the information to as many people as possible. It's finding all the different avenues to get it there. And still know we're still not reaching everyone.
There's been a lot of feedback that we've gotten from our partners here at King County today that has already connected to this week and last week's conversations in this classroom. Are you piecing that together? I'm seeing a lot of, yeah, okay. Is there anything that they have said that's making you wanna inquire more about any of those topics, on the determinants of health, history of public health, history that they've had within the health department? Anything that's gonna making me wanna know more?
I want to hear more about environmental health and like the lead action.
Great. Yeah, so lead is a historical issue, but in Kent County Health Department and the county as a whole has been doing different things to address lead in the city of Grand Rapids too. But like the lead action team and the lead team within environmental health is pretty new. So we have a team of 6 sanitarians within environmental health, and there are boots on the ground people, and so they go into people's homes to do inspections to identify where lead hazards could exist. So that's like the bulk of our environmental health program outside of health education. So they might be working with families who are just concerned, they live in an older home built before 1978, and they're concerned that there could be lead-based paint. Because lead-based paint, just so you all know, is our #1 concern for lead poisoning and lead exposure. We're talking a lot about water lately, as a preventative measure, but really it's the paint. So they go into people's homes because maybe they're worried about it. Maybe there's somebody in the home who's pregnant and is concerned about bringing a new baby into the home or being exposed while pregnant. Or maybe they have kids in the home who have been tested for lead and their blood tests have come back elevated. So that's like some of our biggest community, like out in the community programs that we do within environmental health. They're out there every day doing inspections. And then our lead action team has a pretty basic coalition structure where we have a steering committee and then we have 3 subgroups or 3 sub work groups, focusing on different topics, focusing on clinical aspects. So the actual nurse case management, the medical care that people might need after they're poisoned by lead, or the lead testing that needs to be done. So the recommendation is that all kids get tested at 1 and 2 years old. And then we have an environmental health work group who does more on the housing side, because what do we do when we have old housing stock and if people aren't able to maintain their homes or don't have the resources to do so, or aren't aware that that's something that they need to do to prevent lead exposure? How do we address that? And then we have a social supports work group that is more that community engagement piece, and that's where I spend the most of my time. I coordinate that group to do like the health education, community engagement, content development, and around educational materials and things like that. So we have a lot of different partners going on. We have state and city of Grand Rapids partners within all those groups, and community-based organizations around home repair services. We have all of our major health systems represented. Cherry Health is on there too. Independent pediatric offices as well. We have concerned parents, concerned grandparents, concerned family members too that are just there. So we have a lot of different pieces moving within that group, and a lot of different work going on, but we are trying to, make it kind of move seamlessly and, but also still just trying to figure out how do we do this as a group. And I would say, if anyone is interested in environmental health, I've only been in EH for 2 years now, but from my perspective, it seems like a field that just keeps growing. Within the lead world, there's so much funding available right now. We just keep applying for grants and they are accessible to us. And those grants include adding like staff and positions too. So this feels like a field where it's gonna just keep growing and more positions are gonna be available. So just in case that interests you.
What other things happen in environmental health? Like what other pieces of sanitary?
Yeah, so we have sanitarians that do all of the restaurant inspections, like pop-up licenses too for any food fairs, food trucks, things like that. And then all of our water supplies, pools, wells and septic inspections, rental or real estate certifications for those things as well. And I don't spend a lot of time with those sanitarians, so I don't always know what they're doing, but those are the things that they work on.
There's also a vector-borne outbreak division, so they do a lot of like tick and mosquito collection in the summers. They categorize them, so they figure out what type of mosquito, the mosquitoes, the gender, and then they'll send those out for testing. Because only female mosquitoes take blood meals, so if you're looking at transmission of disease, you're looking at female mosquitoes. They'll send those out to a lab at the state of Michigan and they'll get results back. So that was how we found out a couple weeks ago that there was a case of West Nile at a, there's like a tire, because they throw away tires or store tires, or something like tires, tire yard, yeah, that's what I was looking for. So there's a case of West Nile in the mosquitoes. We have not yet seen it in any people this season, but that's a good cue for us that we need to start doing more education around West Nile and making sure people understand the risks and how they can protect themselves. Same goes for Lyme disease for ticks, so they're testing for that. And then some other diseases they're looking at in mosquitoes would be triple E, so Eastern equine encephalitis, something canyon. Yeah. Yep. West Nile, and then is there anything else?
I feel like those are the big things.
Yeah, that's big guys. So again, that's just if we start noticing a huge uptick, but with mosquitoes, in the in them testing positive, then we know we need to talk to the community about protecting themselves.
And when you talk to the community, how's that done typically via the health department? What is the structure for communication and messaging from the health department out?
Depends by division. So in environmental health, you can probably speak to this better. There's a lot of like swag. So they do a lot of like t-shirts, frisbees. So they're going to a lot of community events at parks and stuff. They've got, educational flyers they're handing out. I think like we would do hand sanitizer, like all different kinds of branded stuff. I know you guys do that a lot. Yeah,
But they're not for your face.
There's like a coloring book. Was that an educational thing or just a fun thing for kids? So yeah, and a lead program. So there's a lot of ways to try to like get family and communities interested in what you've got going on.
There's always press releases too that happen every time we find something. So that always happens. That doesn't mean that that's always getting again to that conversation of like how far do those communications get? So that's another area where I think we're always trying to figure out how to do that better.
How do you communicate in an emergency?
So we have monthly, weekly meetings with a bunch of partners. So my coordinator will send out an email blast to all of the partners that we're on those meetings with on a regular basis. I know that there's social media that Kelso runs, so I know
Do you
that
deal with it when there's like a West Nile case? Like, do you guys?
we only deal with it when a department or division of program is overwhelmed. So
Okay.
once the resources are overwhelmed and they need help, that's when emergency preparedness steps in. So if there's an outbreak and EH has it under control, we let you do your thing, but the second that you guys say we need help, that's when emergency preparedness steps in.
When there's an actual like outbreak emergency, like how do you have a meeting with partners? Or do you guys do press releases? Like, are you going on the news? Because we do some.
Carla
news
has done
things.
that before. Yeah, so the previous
Radio.
coordinator, she goes on the radio, she's done news stories. I haven't experienced any of that in my time yet, but I will. It's coming.
Social media, do you all have a communications section where social media and some of that is streamlined as well?
I wouldn't say streamlined, it exists, so anything that goes out of the health department, this was like. We're like kind of slowly shifting back to it, so during COVID, it was a lot more flexible, so we were able to get messaging out because we had to immediately. But pre-COVID, and we're starting to see it again, there's just more of a checks and balances, so it has to get approved by communications, and that can just take a long time, so. I would say we're not super active on social media, that's why we really rely on our partners to get information out. During COVID, we did create a program called our Community Connectors and Navigators, and so they're people that represent specific populations that we knew for COVID. We're not getting COVID information fast enough, or not in the language they needed, it wasn't culturally appropriate, whatever the case may be, there was some barrier. And so we worked with them so that they could directly communicate with their population, their community, in a way that made sense. So for some people, that was WhatsApp, which previously was not something we really dealt with as a health department, but they would like do WhatsApp blasts. They did a lot of social media posting, newsletters, emails, whatever kind of format they would do, posting things in grocery stores, whatever it was. So that was a really useful tool, and we still have them. They're part of the Health Equity Council as well, so that's been really great.
This is great. Did you all enjoy? Take a moment to thank our partners. So many great connections with the work that you are all doing and these first couple of weeks for these first year students to make those connections between just generalized topics we've been talking about as we kick off public health, and hearing how it's applied in the field was amazing. And I really enjoyed that. Hopefully you all did too. Yes. All right. Well, thank you so much for being here with us. I'm gonna go ahead and stop my recording.